From our perspective, we're building a whole platform that can support the whole value chain from different areas. So we've talked about the Automate EBMR, which is the batch record piece. What we're building is downstream the Automate Assist, which is supported by Innovate UK funding, and that is about supporting the review process. So to give you an example how big the problem there is at the moment, the manufacturing may take 10 days, but it may take a further 5 days to release this product because we have to go through and carry out all the checks that we need to do. With a digital system, we're hoping to bring that down to a day or less. And then the other elements that we're building is what we're calling Automate Clock, which is the scheduling of all of the inputs. So not only the patient's material for manufacturing, we need to be able to assign manufacturing operatives to the actual manufacturing runs, and also know that the equipment is validated and ready to go as well. So the scenario in the manufacturing setting is that you have large clean rooms that will have multiple workstations to make products for individual patients all at the same time. And the challenge here is to show control. And we're looking at technology such as geofencing and creating a digital mesh so we can track consumables operatives as they move through this open space where there's multiple workstations. At the moment, it's reliant on procedural control and people signing on pieces of paper that they promise they've done the right thing in the right order. Whereas in the future, I see it completely digital and it's passive, and so it's happening as the process is happening.